Hello, I'm Melissa with Medical English Melissa. I'm a nurse practitioner and a midwife from the United States, and I'm also a TEFL certified English teacher. And I teach, as you might have already guessed, medical English. This is Medical English 5-Minute Clinic. It's a 5-minute medical English lesson for you to practice on the go. And then if you have extra time to study, there is a free study guide with all of the things that I went over in this video in more detail so that you can practice on your own and make the most out of this lesson. So for most of my students, the thing that they are most nervous about is either giving a shift change report to another nurse, or presenting a patient during rounds or something of that sort. And so what I like doing is breaking it down into smaller pieces and talking about those smaller components of doing this. So today I'll be talking about vital signs, and specifically the verbs around vital signs. I'm going to give you an example right here. For the record, this is just my way of saying this, and it's not going to be completely medically accurate because I'm trying to keep it super simple for an example, okay? Let's see. I have Jane Doe here. She's a 36-year-old female. She's a G2 P1 at 38 and 5. She presented to the triage unit for rule-out preeclampsia after 2 elevated BPs in her midwife's office. We're awaiting labs. Since she's been here, her BPs have been normal. Her last BP was 124/68. The rest of her vital signs have been normal. Her heart rate's been in the 90s, but she seems pretty anxious, and when she's resting, it drops to the low 80s. She's been satting in the high 90s on room air. Her respiratory rate is 18, and her last temp was 98.6. Baby's been looking great on the monitor. There's plenty of variability, and has been hanging out in the 120s. I know that seems like a lot, and when you hear that, you might feel a bit intimidated, but it's really just about breaking it down into smaller pieces and learning the smaller pieces. And once you understand each component of it, instead of just memorizing these phrases and not knowing how else to use them, you can learn each individual part and be able to apply it to other parts of your medical English. So first, I want to get a few small things out of the way. The first one was that I said G2 P1. And that's gravida 2, para 1. So gravita's pregnancy, para's birth. So she's been pregnant twice. She's given birth once. She's pregnant with her second right now. And then the other term that you heard was, I think I said she was 38 and 5, 38 weeks and 5 days pregnant. What other terms did I use that you guys might not know? So when I said the monitor at the very end, I was talking about the fetal heart monitor, measuring the fetus's heart rate. And variability is just an aspect of that. And I was talking about the fetus's heart rate when I said 120. Other than that, I just want to talk to you guys about the verbs that I used. So before I go any further, I want to say that if you're enjoying these free lessons, it'd be really helpful and a great way to say thank you if you subscribe to my channel and if you share these videos with friends. It's the best thing that you can do to support me, and it's completely free. Okay, let's keep going. So the first one, I said to drop. And so to drop is just another way of saying to go down. So her heart rate dropped, right? Her heart rate dropped. Her heart rate went down. The other one I used was satting. So that is slang that's short for oxygen saturation. So a patient is satting at means a patient's oxygen saturation level is at a certain point, right? So you can say satting, and they're satting at a certain number. They're satting in the 90s. They're satting in the 80s. Hopefully they're not satting in the 70s. Which brings up another one. You can say desatting. So if a patient's hanging out, I'm using all the slang already, hanging out in the 90s, and then it drops, it goes down. They're desatting to, let's say 70, right? So it's desatting. So that's another one. And then the other term I used, which I just used again, is hanging out. Super casual, relaxed way of saying it, but absolutely used when you're talking to other medical professionals. So if you say that something's hanging out in a certain area, right, that means that it's staying within that range. It's not diving down really low and it's not going up really high. It's hanging out in a certain area. Other ways that we can talk about something going down. You will hear tube lower. For example, his blood pressure medication, his antihypertensive, lowered his blood pressure. To tank So that's when a number quickly goes down, and not in a good way. So you could say that someone's blood pressure tanked, and that means that it dropped quickly and is a bad thing. So to tank. To tank is slang, by the way. I wouldn't write to tank in a chart, but I would definitely say it to a colleague. Now for verbs that talk about going up. So we can say to raise. For example, the patient was satting in the 80s, and so we put her on oxygen to raise her O2 levels. Another quick one would be to jump. So you can say to jump to a certain number. So after we gave the patient the medication, his heart rate jumped to the 150s. To elevate. So in the example I gave, I used elevated, which is an adjective to describe the blood pressure. So the patient had elevated BPs, but we can also use it as a verb to elevate. So if a patient's blood pressure was too low, you could give them a medication to elevate their BP, to bring it within normal range. To increase. When we woke the patient up, his respiratory rate increased. Another really great verb is to stabilize. So when something is fluctuating, that's another one I'll talk about, fluctuating erratically to unsafe levels, we want to stabilize it, right? So if someone's, any sort of their heart rate, their BP, whatever, is going up and down, we're trying to stabilize it to something that's within a normal range, within normal limits, if you will. So we gave the patient the medication to stabilize his blood pressure. And I mentioned fluctuating. So if you couldn't tell from my hand motions, fluctuating is something that goes up and down. So you could say, I'll come up with a complicated one right now. She's satting in the 90s right now, but overnight her O2 levels were fluctuating wildly. And so I don't trust that it's not going to drop down again. She's not going to desat. Hopefully that phrase makes a little bit more sense now than it did earlier. If you have questions about what I covered in this video, you can ask me in the comments and I'll always answer. You can of course find me on all of these social media options right here. Thanks so much for joining me, and I will see you in next week's episode of Medical English 5-Minute Clinic.